Hi, my name is Perdita, and I have Tristan again here to help me do some range of motion testing. So, the first thing that we can do that is simple is test his TMJ joint. And I'm going to ask him to open his mouth and close. I didn't feel any crepitus. He denies tenderness. He denies pain. Now I'm going to ask him to sit to the side of the bed. And I'm going to ask him to bring his hands out and bring them out over and touch his hands to his each other. And can you do that by yourself one time, please, without me touching him? Okay. Thank you. And can you put your hands to the back of your head, please? Okay. And then drop your hands to a normal state, and then bring your hands and try to touch your shoulder blades. Okay, good. Is there any pain or tenderness?
Mm-hmm.
Okay. You can return to a normal state. And I'm going to palpate his joints. There's no pain, there's no heat, there's no swelling. I'm going to ask him to rotate his shoulders internally, and I'm going to palpate for crepitus at this time. Okay, and rotate externally. Good job. And try to lift your shoulders up with me pressing down. Good job. I'm going to take your arm, and you try to keep your hand down while I'm pressing it. Okay. All right. And he has good muscle tone in the shoulder joint. Now I'm going to ask him to take his chin to his chest, chin to the ceiling, and then I'm going to ask him to return to normal and touch his left ear to his left shoulder and touch his right ear to his right shoulder. And I'm going to ask him to turn his chin to the left side and then turn it to the right side. Okay. Is there any pain or tenderness? Okay. And now I'm going to move on to the elbow and the hands, and I'm going to ask him to turn back around. And at this time we can perform 2 exams. Phelan's test. I'm going to ask him to bring his hands up and put the backs of his hands together like this and bring them up in a 90-degree angle. And the provider holds this, helps the patient hold this in a 90-degree angle. And after about a minute, we're going to ask the patient if they have any numbness or tingling. Have you had any numbness or tingling? Okay. He denies, so he can return to a normal state. And then our another test that we can do is Tunnel's sign. And what I'm going to do is I'm going to hold the wrist joint with the elbow joint. I'm going to palpate the ulnar nerve. I'm going to take my middle finger and tap that ulnar nerve and ask the patient if he had any sensation, numbness, or tingling, or pain. Mm-hmm. Okay. So he can return to normal. And then can you lay your hands down flat on the surface? Okay. And can you rotate them? Thank you. And then rotate them back. Spread your fingers apart. Okay. And take your hands and point them towards the ceiling. Take your hands and point them down. Okay. Take your hands and point them outward. Point your hands outward. And point your hands inside. Okay. Any numbness or tingling? Mm-hmm. Okay. And I have palpated his joints, and there is no deformities, no masses, no numbness, no tingling, no heat, no tenderness, no swelling. And the size and contour of the joint is appropriate for his age and with the rest of his body. There are no enlargements found. We can go on to the hip joint now. Can you lay flat for me? going to palpate his hip joints. There's no numbness, tingling, no tenderness. Okay? And slide my hand down through there, and there's no heat. Raise his leg, his pant legs up. So, another sign that we can do is the bulge sign. And I'll just take the back of my hand and run it up his knee. And then I'll bring the other hand, my hand back down the other side and watch for a bulge. And there was none. And also, I can do McMurray's test. And I'm going to ask him to bring his leg up, and I'm going to hold on to the knee and to the heel, and I'm going to rotate and bring it up, bring it out. There's no crepitus, there's no tenderness, there's no pain. And as far as his foot goes, I'm going to ask him to point his toes towards the ceiling and point them downward. Okay? And I'm going to ask him to rotate his foot inward and rotate them outward. Now actually rotate your foot in like that. Good job. And rotate them outward like that. Okay, good job. I'm going to palpate each joint. There's no redness, there's no warmth, there's no pain, no tenderness. The size and contour of each joint is appropriate. I'm going to ask him now to stand up. I'm going to ask him to bend forward.
Right there.
Yeah, she can see it, I think. Just go ahead and bend forward. Okay? And then bend backwards. Okay? And does that cause you any pain or anything like that?
Mm-hmm.
Okay. And then bend side to side. Okay? No pain, no crepitus, nothing like that?
Mm-hmm.
Okay. You can have a seat. Some muscle testing that we can do is we can have the patient hold their arms up like that, and as I gently pull, you pull away from me so I can test your muscle strength. Okay? And he has good muscle tone. And we can do the same for the you can lay down. For and pull away from me. Good job. There's also another test that Lesag's test that we can perform. If you'll lay down flat for me. And what we're doing, it's somewhat similar to McMurray's. We put our knee up and we hold on to the ankle joint and we extend the leg into the air. And we ask the patient if there's any pain in the leg or the back. Any pain? Okay. And I did not feel any crepitus during this exam. So I'm going to ask Tristan to put his feet together, and we're going to do some hip exercises. I'm going to ask him to bring both knees up into the air at 90-degree angles. Good job. And back down. And then I want you to spread your legs apart. Okay. Take it up off the bed. Okay, now put them back together. Now one at a time. Take your right leg and bring it out. And then adduct it back in. And take your other leg and abduct it away. And adduct it back in. Any pain or tenderness? Okay. And This concludes our range of motion testing today. Thank you.